To finish up our discussion about the lifespan nutrition, we need to look into adulthood, younger adults, middle age, and older adults. How does nutrition change as you age, and how can you support your body to the best possible ability? We'll begin this discussion with young adulthood. That's the age of 19 to about 30 years of age. Now, typically in young adulthood, you're at peak physical form. Your body is going to have its full height achieved. Your muscle to fat ratio will be the best, most likely, of your life because your body is really all set and ready to go. So at this point, quite often, you have a very low occurrence of muscle and joint problems. Now, I say low occurrence because obviously it can happen, but typically this age range doesn't have a whole lot of joint issues except from injury-based issues. Nutritional requirements. Well, at this point, they're pretty much the same as what it was for the late adolescent range. That's up to about 18 years old. You're looking at, for females, about 1,800 calories up to about 2,400 calories. And for males, you're looking at about 2,000 upwards of about 3,000 calories. Now again, obviously those ranges depend on how active you are. A more sedentary life definitely down on the bottom of the ranges. A more active life would push more up towards the middle and higher end of the ranges. So don't just assume that, hey, I'm at the top of the range. See how your body responds. See if your body needs that much as a caloric intake. The breakdown of those calories are still about the same, looking at 45 to 65% for carbohydrates, about 10 to 35% for protein, and about 20 to 35% for fat or lipids. And again, ranges, because it depends on what your body needs, how your dietary intake looks, but it's all about figuring out how your body fits within those typical ranges. And it might not. Your body might be a little different and you might need some more caloric intake or a little less caloric intake. Again, everyone's body is unique. These are the typical or the average ranges. So most people fall in there, but it might not be everyone. But as you're starting to go towards the end of this range, so getting towards the upper 20s and pushing 30 there, your body might start to be going through some of the aging changes. Now, everyone ages at a different rate, not the physical years, but how their physical body ages. So you might start to see the cholesterol level starting to creep up a little bit. You might notice that blood pressure is starting to just get a little bit higher than it was throughout the past decade or so. So this is when nutrition becomes even more important, because trying to balance your nutritional intake and take into account things that might be happening. So for example, if cholesterol is increasing, you might want to make sure you increase your soluble fiber amounts, because soluble fiber will help control cholesterol levels. Or maybe you're looking at insoluble fiber, helping to help deal with bowel regularity. So different aspects of your diet might be needing to change a little bit to compensate for how your body is starting to change as well. Nutrition isn't just a single, here it is. It is fluid. It changes with your body. As your body changes, you may need to change your nutritional intake to try to match what you need or help to compensate for things that are changing. And that becomes more and more important as we move into the next two phases as well. So let's look at middle age. This is 31 to 50-year-old. Now in this range, a lot of times some of the more obvious signs of aging will occur. You'll start to see more wrinkles. Hair will start to either change color potentially or fall out depending on individuals. Vision might start to decrease a little bit. Maybe you might need to have those reader glasses that helps you read a little bit closer up because you can't quite see as easily. If someone was an athlete as they were younger, that athleticism might be helping with the body throughout, but at this point might start to catch up with some of the joints or some of the muscles might be having pain from past injuries or overuse during the athletic career. So the body's changing even more than it was in young adulthood. But what's interesting is this range here, this 31 to 50-year-old range, this middle age, it can have quite a drastic change from the beginning to the end. Now, obviously, it's going to be different male versus female here. In the case of women, 31, they might be pregnant at that point. But by the end of this range, towards the 50, might be undergoing menopause at that point. So two complete opposite ends of the spectrum can fall in the same middle age range. And now both of those, pregnancy and menopause, will have different nutritional needs based on the individual. So in the case of menopause, the hormones are changing dramatically at that point. There might be changes in bone density, so vitamin D and calcium can be really important here. You're looking at an increase in caffeine and sodium levels might be detrimental, so you gotta get those out of there because hot flashes might be occurring. And by removing high amounts of caffeine and removing high amounts of sodium that you might have typically had before, might help to reduce the levels of hot flashes. So it's all about trying to compensate and adjust nutritional intake based on how the body's responding. So it's all about a modification. As far as the pregnancy, we already dealt with that in the very first video here, so I won't rehash all that differences. But the body is also, unfortunately, going through a physical decline typically. Most individuals from the age of 31 to 50, by the time they're 50, they just can't do the same things they did when they're 31. The muscles and the bones are just decreasing a little bit. They're not quite as strong as they were. Nutritional intake has also changed a little bit. You don't need as many calories. Typically about 1,800 to 2,200 calories is good for both men and women in this range. Now, if you're highly active, still playing a lot of sports, very active, you might need to bump that up a little more. Again, it depends on what your body needs and how your body is adjusting. Micronutrient increases. Magnesium, folate, vitamin B12, vitamin B6 all need to have slightly increased levels throughout middle age. Now, the vitamin B6, for example, that's helping to prevent elevated levels of homocysteine. Now, homocysteine is a byproduct of metabolism, so it happens naturally. The problem is, the more and more homocysteine that builds up, the more potential issues there are for the walls of the arteries, an increased risk of atherosclerosis, so hardening of the walls. This can all lead to problems in blood pressure and blood flow and a whole lot of other issues. So it's important, again, to increase these just a little bit to help with combating the changes the body is going through. Now, other things that might help, increasing antioxidants. Now, antioxidants are always good to help get rid of free radicals. But as the body ages, those free radicals can increase so the antioxidants can help. The carotenoids, omega-3 fatty acids, also increases can help the body compensate for the different changes. They can help prevent health declines that are occurring. Things like cardiovascular disease or coronary artery disease. They might not necessarily stop it, but they can at least help to slow down or prevent until much later. It's about trying to give your body the best and healthiest options possible for life going forward. And as you keep going forward, we're moving into older adulthood. This is the ages of 51 and beyond. A lot of times referred to as the golden years. It's at this point you'll really start to see the advanced stages of aging. Not that that's a problem, but they're just the body's changing. And your nutritional changes will have to modify and change with it. You're seeing an increase in joint problems. The skin isn't quite as elastic, it doesn't quite heal as easily. Muscle mass is slowly declining. Bone density is slowly declining. And to try to slow that down, so you're trying to not have bone density loss, vitamin D, calcium, vitamin B6, trying to keep as much of that bone density intact as possible. Caloric needs, well, they're all lower. Individuals typically aren't as active 51 and beyond as they were in their 40s or 30s or 20s. So by being less active, you need a lower amount of calories. Now, it's not saying no activity. 51 and beyond might still have plenty of activity, but you're probably not running the same distance, the same speed you were if you're a runner in middle age and your young adulthood. Or if you're cycling, maybe you're not cycling as fast or as far as you used to. Still cycling, still staying active, but things are slowing down a little bit, which means your caloric intake needs to match that, needs to slow down as well. If you don't decrease that caloric intake, then unfortunately the excess calories will start to build up and accumulate as fat reserves, increasing weight. Now, an increase in weight can lead to other health risks and problems, especially if that weight increase keeps going and going to reach the stage of obesity. Now, naturally in this age range, there's an increased risk of different disorders. Things like diabetes, high cholesterol, cancers, heart problems. So you're trying to make sure that your nutrition is trying to support and help prevent as many of those as possible. So the older one gets, the more and more important nutrition is to balance off those omega-3s, the omega-6s. You make sure you're getting the carotenoids, the antioxidants, all things we just mentioned previously. In middle age, you still need in older adulthood. But sometimes these aren't as easy to obtain because sometimes as the body ages, the changes make it harder to eat certain foods. Dental problems could have an impact on what foods are being eaten, or at least what foods are being enjoyed to be eaten. That can then limit certain foods and make it harder to obtain certain nutrients. Decrease in senses. Now, sure, eyes, vision, ears, hearing, you know about those two, but taste is also decreasing. And as taste decreases, maybe that food that was really enjoyed isn't enjoyed as much anymore, which means certain foods that were eaten now just don't want to be eaten as much. So again, that also can decrease the foods that are being eaten. Dysphagia might develop. What is that? Basically, dysphagia is a difficulty in swallowing. And by making it harder to swallow, again, other foods might be difficult to eat and ingest. Also, further limiting how much food is being taken in. Now, all this decrease in food potentially could lead to a problem of not eating enough. So therefore, under the amount of required calories for your body. This can almost sometimes take on a state of an anorexic-like state. Now, it's not necessarily anorexia, but the lack of eating, just not wanting to eat, not caring to eat, difficulty eating, can sometimes trigger what looks like or might seem like an anorexic state. And to compound all that, digestive issues are more frequent, which means the body might not absorb the nutrients as easily as previous. So all these things could be compounding and causing problems with dietary intake, which means it's even more important to figure out how to balance those macronutrients, how to balance the micronutrients, to make sure there's a wide range and everything is covered in the diet that is being eaten. Sometimes trying to maintain an active lifestyle can help out. Just helps make someone a little bit more hungry. They want to eat a little more because they're active and doing things. The body needs more energy. It's this active lifestyle and this nutritional balancing that become more and more important as one ages, right from young adulthood to middle age to older adulthood. Activity, balancing diet, and making sure you have a whole range of macronutrients and micronutrients all are important. But as you get older and older and older, that nutritional balance becomes even more and more important. So the ranges of change that occur from birth and even pre-birth, so we're talking pregnancy, right up through older adulthood. Nutrition changes throughout the ages. Your body changes throughout the ages. You need to make sure you match nutrition to your body changes. Until the next video.